like to take a moment and discuss the process of what happens between a retiree and a benefit advisor. The first job of the benefit advisor is to educate the retiree on exactly what's going on. Yes, your group plan from Xcel Energy is ending on December 31st, 2012, and it's our job as benefit advisors here at Extend Health to help you find a new plan for 2013. We're going to take a minute and discuss with you on the telephone some very basic information. What does Part A of Original Medicare do? What does Part B of Original Medicare do? What do Medicare supplement plans do? And what do Medicare Advantage plans do? What are the primary differences? We're going to answer any questions that you have so that you feel comfortable at the very beginning of the process. Our second job as benefit advisors here at Extend Health happens to be evaluating your individual healthcare needs. So we're going to ask you a series of questions. How many doctors are you seeing? What prescription drugs are you taking? How often are you traveling? Questions like that. And the answers to those questions are going to give us a good idea of what healthcare plan is going to work well for you for 2013. Once you and I have had that discussion, or you and your benefit advisor have had that discussion, we're going to help you. We're going to come to an agreement that that's the correct plan for you. That's important. And then we're going to help you enroll in that plan electronically. So the benefit advisor takes care of the entire process. They basically have an electronic application where they ask you some very basic questions, and they help you fill out the application and submit it. No paperwork required on your part. Finally, the most important thing that we do as benefit advisors here at Extend Health is we manage your healthcare needs moving forward. So the process of evaluating and enrolling the retirees is pretty straightforward. But what we don't know, because we don't have a crystal ball, is, perhaps you move during the year, or maybe you start taking new medications, or maybe the doctor that you're seeing stops practicing. Whatever it might be, maybe you have questions about how your plan works. Extend Health is going to be your primary point of contact for all those questions and whatever other questions you might have. We're here year-round to answer whatever questions come up and alleviate any concerns on your part. The first piece of information that you should get in the mail is going to be a co-branded Getting Started guide from both Xcel Energy and Extend Health. And it basically asks you to do some very simple things. It says, go ahead and write down who your doctors are. Go ahead and write down what your prescription medications are. Get out your red, white, and blue Medicare card and write down that information as well. And finally, call Extend Health. And you can reach us here at Extend Health at 888-825-2664. Again, that's 888-825-2664. So we're just asking you to write down some very basic information and to give us a call to have that first discussion. We're going to collect that information from you. So the benefit advisor is going to ask you for all that information you've written down, and we're going to set up what we call an enrollment appointment with you. So at some point down the road in the future, you and I are going to set a date that we agree on where we can discuss actual plans that will be available for you to select. Okay? You also have the option of visiting us online at www.extendhealth.com/Xcel Energy. Something that everyone should be aware of for this discussion is that any pre-existing conditions that you have will not limit your plan selection, okay, except for end-stage renal disease. So if you have ESRD or you have end-stage renal disease, let your benefit advisor know, and we will walk you through that process. Everything else, though, whether you take 10 different medications, or whether you have had surgery in the last few weeks, or you're dealing with cancer, whatever it might be, those pre-existing conditions will not impact your plan selection or your plan pricing. Very important to know. Once you've had that first discussion with the benefit advisor at Extend Health, and we collect those three pieces of information from you, your doctors, your drugs, and your red, white, and blue Medicare card information, we set up that enrollment appointment with you at a later date, for a later date. Once you've done that, you will get what we call an enrollment guide in the mail, and it just basically helps you prepare for your enrollment discussion. It talks about Part A and Part B of Medicare, the basics of the plans that you're going to be able to select from. And it also just provides you a confirmation letter so you know the time that your enrollment appointment is going to take place. Again, it's all done telephonically. We have a variety of different tools that retirees can use if they like to. So we have what we call the prescription profiler built into our website. If you want to take a minute and go to our website and find out maybe what your costs are going to be with the individual market plans for prescription drug plans and supplement plans, that's absolutely fine. Please keep in mind that this is really our job as benefit advisors. We put this tool out there for whoever might want to use it, but ideally, the benefit advisor is going to walk you through these steps. You don't need a computer. You don't need any of that. This is just a side tool that you're welcome to use if you like. It works really well, and it's very slick, and it's absolutely there for you. I want to take a minute and talk a bit more about the people that are evaluating your individual health care needs and enrolling you in these plans. And these are licensed benefit advisors. Our entire workforce is based in the United States. All of these benefit advisors have been through 5 weeks of Extend University. They are licensed health agents. They are certified and appointed in different states with different carriers. Okay? These benefit advisors make a base salary, and they are not compensated more to give you one plan over another. So there's neutral compensation in our plans. Our hours of operation are Monday through Friday from 7 a.m. to 8 p.m. Central Time. And the enrollment period for Xcel Energy will be between October 3rd and December 31st. Again, I want to take a minute and reiterate that number for you. It's 888-825-2664. An interesting thing to note about our benefit advisors is that the average age is 43. So we have a seasoned workforce here who understands the process and have been doing this for several years. Not necessarily people that are just out of high school or anything like that, but this is generally a very seasoned workforce that you're going to be talking to during this transition. When you do make your plan selection, when you and your benefit advisor find that plan that fits your individual needs, there are a few things we have to take into consideration here. The benefit advisor can discuss coverage options with anyone, meaning a family member or a friend or a caregiver, and only needs to speak to you, the retiree or participant, to complete the actual enrollment. So if you want to have someone on the line, by all means. We understand that this is a complicated process, and we want to make sure that it's as easy to understand as possible. Once you have made a coverage selection, again, the enrollment into that plan takes place over the telephone with your benefit advisor. We facilitate all of that for you. Once you've selected your plan and enrolled in the plan, you will receive a confirmation of your enrollment from the insurance carriers you selected in the mail. And as a final note here, 100% of our calls are recorded.